Allopurinol. Allopurinol is an urate-lowering agent. Some will call it urate-lowering therapy. Allopurinol. Do you want to know all the facts about this medication? Let's go. We'll be dealing with uric acid that will come from xanthine or apoxanthine, but let us have that knowledge that we are dealing with purines, adenine, guanine, apoxanthine, and xanthine. And we'll be talking about gout and gout and gout, right? We can get into trouble with gout when we are dealing with alcohol, meat, gravy, oatmeal, uncooked, or scallops. And the list goes on to include liver, kidneys, brain, bacon, beef, pork, lamb, also peas, peanut, mushroom, tuna, mackerel, and just a whole lot of agents that could give us, purines. And all these could give us gout. Now, allopurinol is going to deal with two major things: hyperuricemia and gout. Okay, if you want to know more about gout, please kindly click on this very link. I have a full presentation on gout here. Also, tumor lysis syndrome, you can get more pieces of information through this link. Let's take the first note. Allopurinol is well tolerated, and it is frequently used as urate-lowering therapy or urate-lowering agent. It is relatively inexpensive. We have to reduce all possibility of hypersensitivity reaction that we can prevent. Okay? In that case, when it is about allopurinol, let's take care of HLA-B5801 by having genetic testing. And not in everyone. We will be focusing on people from Asia and Africa, particularly people from Taiwan, from China, from Korea, and Thailand. Also, African Americans in the United States and other African, nations. Why that? They are more sensitive, or the probability of hypersensitivity to allopurinol is common among this group. The negative genetic testing can give us maybe a kind of euphoria for the moment, but that doesn't rule out hypersensitivity, meaning we still need to keep an eye on everyone who will take allopurinol for the first time and watching out for allergy or hypersensitivity, even when the genetic testing is proven to be negative, meaning the individual is not having this HLA. That doesn't rule out hypersensitivity. And even in others, the white, the Latinos that will not be tested, they can still come down with hypersensitivity reaction to allopurinol. Renal function is a big determinant of the dosage of allopurinol to be administered. And why that? This is because the dosage will be directly dependent upon how good or bad the kidney is. So we will go for the level of estimated glomerular filtration rate or creatinine clearance. The lower each of these or both, the lower the dose and the shorter the period, meaning the frequency. So the kidney with good values, meaning good kidney functioning well, then we can give higher dose of allopurinol and more frequently. So when the kidney is in trouble, renal impairment, estimate what glomerular filtration rate is and creatinine clearance. If they are low or one of them is low, then go for the lowest dose possible and for the shortest period of time. Severe hypersensitivity could be up to 25% when it comes to fertility, meaning hypersensitivity could claim lives through the use of allopurinol. Acute flares of gout is not uncommon, meaning could be present when the individual is on allopurinol within the first 3 to 6 months, but sometimes up to 8 months or even a year. Please, either per oral or intravenously, anyone that will take allopurinol must have fluid intake generously. There may be flares, either because we are administering allopurinol or just gout flares before the use of allopurinol. Either case, we can help ourselves with colchicine, non-steroidal anti-inflammatory drugs, or steroids in the face of flares. It is metabolized to oxypurinol and excreted as such as high as 75% in urine and as about 25% unchanged in feces. You can see why no kidney must be functioning properly. Allopurinol is compatible with normal saline. Remember I said fluid generously, right? Normal saline is okay or 5% dextrose. In acute gout treatment, we use non-steroidal anti-inflammatory drugs, ice, rest, steroid, then we grab allopurinol and some other urate lowering agents. If you want more on that, kindly click on this link. Now, these medications could come under different brand names, and you can pause to have a look, depending on the one that is available in your jurisdiction. Allopurinol is a xanthine oxidase inhibitor, anti-gout, and anti-uric acid. Uses mainly for two things: gout and hyperuricemia. As for gout, some will say, well, allopurinol is not for the treatment of gout, it's only meant for prevention. Others will say, yeah, it's for the treatment of gout. Well, let's explain why it appears to be. The reason is when there is gout arthritis, there will be pain. There is inflammation. Allopurinol is not expected to handle the pain and inflammation quickly. But research is ongoing, and some experts are now saying that allopurinol actually possesses the property to alleviate both pain and inflammation. The knowledge before now had been that we have to get other agents to deal with the pain and inflammation. That is why those who believe in the olden days that allopurinol is not for treatment of gout could be right, and they limit it to preventive measure only. But those who say allopurinol is meant for the treatment of gout are right, because new research is now pointing to the fact that allopurinol possesses property to deal with pain, analgesic property, and deal with inflammation, anti-inflammatory properties. But let's get other facts that when it comes to gout, allopurinol would decrease serum and urinary uric acid in either primary or secondary gout. All we want to get is, we don't want more uric acid that is causing the problem. In early or uncomplicated gout, yes, the use of allopurinol is welcome here and is going to be helpful. If uric acid excretion is greater than 900 mg daily, or the serum urate is greater than 8.5 mg per dl, some will put it as 9 mg per dl, it is better here to use allopurinol than the other uricosuric agents. If uricosuric agents are contraindicated, then we go for allopurinol. In gouty nephropathy, with or without secondary oliguria, we go for allopurinol. Still on uses, now hyperuricemia. Remember, we just touched on gout, right? But there's no gout without high level of uric acid. So some conditions will exist that will not be gout per se, but high level of uric acid in the system. In that case, allopurinol will be helpful, like tumor lysis syndrome prevention, in kidney stone that is containing calcium or uric acid. For prevention, we use allopurinol. In hyperuricemia that is associated with chemotherapy, we use allopurinol for prevention. As a matter of fact, I'm going to talk more about this. Even in Lesch-Nyhan syndrome, that is hyperuricemia due to inborn error of purine metabolism, we use allopurinol. Still on uses, to reduce hyperuricemia secondary to G6PD deficiency, in ethambutol leading to hyperuricemia, or use of thiazide with hyperuricemia, or in sarcoidosis or polycythemia vera. As a matter of fact, all conditions leading to hyperuricemia, except where allopurinol is contraindicated, allopurinol should be adopted. Still on uses, in uric acid stones, azotemia, or positive family history of tophi and low urate excretion, allopurinol will help. Forms. Allopurinol can be in form of tablet for peroral use. You can find the generic or whichever brand that is available in your jurisdiction and under the following strength. Can be in form of solution for intravenous use. It could be generic or this brand or any other brand that is available. Please contact your pharmacist. And most of them will come in 500 milligrams per vial. Administration. Please, generous fluid intake. Anyone that is dehydrated must be rehydrated before administration of this medication. Please. If you can even take the time to know how well the kidney is functioning, with renal output that must not be less than 2.1 liters per day, that would be better. But if it is greater than that, excellent. So you can then go ahead with your per oral administration with generous fluid, please. Remember, I've repeated fluid, just in one page. Still on administration. Now, when it is about intravenous infusion of allopurinol, I'm back at it. At what? You have to hydrate well, please. Please. Before IV infusion. And it could be given as intravenous infusion as a single daily dose, or you get, your calculator calculates the total dose per day and divide into 3 or 4 doses. Get the total daily dose, and then you divide, 4 equal parts given every 6 hours, or you divide into 3 equal parts given every 8 hours. In all, please don't rush. Give slowly and give for about 30 minutes to 1 hour. You can contact your pharmacist or you check the monograph if you are confused, please. In chemo-induced hyperuricemia prevention, you will give allopurinol slightly differently. Why that? You've hydrated very well. Thank you. Then the next thing is before you administer your chemotherapy, then give allopurinol first. And not just 1 hour, 2 hours before. Give it a whole day ahead of your chemotherapy. For example, you want to give chemotherapy on a Tuesday. Please administer your allopurinol on a Monday. You can even do it 2 days before you administer the chemotherapy. Mechanism of action. The action of allopurinol and its metabolite, that is oxypurinol, is to deal with apoxanthine and xanthine and lower the level of uric acid. How would that happen? By inhibiting the enzyme that will convert apoxanthine to xanthine, which is xanthine oxidase, and also the same enzyme, xanthine oxidase, that is meant to convert xanthine to uric acid. So the work of allopurinol is to block the action of xanthine oxidase that will be involved in 2 steps that may finally produce uric acid. So at the end of the journey, we'll be expecting decreased level of uric acid and higher level of apoxanthine and xanthine because the conversion is halted. Still on mechanism of action, to make it clearer, allopurinol and its metabolite will block or inhibit the action of xanthine oxidase, preventing the conversion of oxypurines, that is xanthine and apoxanthine. And then uric acid is not produced in the serum and is not produced in the urine. Now, we have urine that is filled with xanthine and apoxanthine. Monitoring. We will take the history again. The history we took that led us to determine that we need allopurinol will be repeated. And from that history, we'll know if we are winning or not. Of course, we'll do physical examination. It's not hidden. Gout arthritis. We're going to see where the gout is and check again if we are winning or not. Then we head to lab. Beta chronic gonadotropin in every woman of childbearing age. We want to know whether there's pregnancy now or not. Remember, it's been categorized as B2 or never been categorized at all by some. So, many people will not be comfortable with the use of allopurinol in pregnancy. I will not be. We'll do renal function test, liver function test, complete blood count, including differentials, and of course, electrolyte assay. Contraindications. As said earlier, this medication is well tolerated and inexpensive and prescribed by many physicians to deal with hyperuricemia, or in gout. But not everyone could take it. In the aspect of immunology, anyone with positive history of hypersensitivity to allopurinol or any component of its formulation is excluded, meaning that individual cannot take it. And genetic testing has been done. HLA-B 5801 positive? No. Anyone taking the dinosine, you cannot take allopurinol at the same time. No. Still on contraindications, in pregnancy, I would say no. No allopurinol. But if you are by yourself in a remote part of the world and you have no option, you discover that the life of the mother is in danger and that of the child is not saved, and allopurinol could help and no other agent, just contact any pharmacist or clinical pharmacologist around, or better still, OBGYN specialist, and that make that determination. In Australia, allopurinol is category B2 when it comes to pregnancy. In USA, it's not even categorized at all. Also, in breastfeeding, I would say no. But it is not an absolute contraindication. Okay? You must monitor the child for allergy, and you have complete blood count done with differential in that child because it is found in human breast milk. Adverse reactions, mostly well tolerated, and many people will prescribe allopurinol. It is relatively inexpensive. Some of the following adverse reactions that I'm about going into could be present in you if you are taking it, and you might not even encounter any of them at all. But truth be told, that if you are on allopurinol, you might encounter any of the following and more. You might have allopurinol hypersensitivity syndrome with scar, rashes, Stevens-Johnson syndrome, toxic epidermal necrolysis, drug reaction with eosinophilia and systemic symptoms. You can have flares. You're ready on allopurinol for gout? Yes. And now you are having flares again. Why that? Okay. The allopurinol is already in your system, and that will lead to a drop in serum urate level. Okay? Then monosodium urate will be mobilized from the intra-articular deposits that's already causing the gas, right? Okay, because the serum level of urate is now lower. So mobilization will occur using monosodium urate already deposited within the joint. Okay, now reaction will occur between the crystals and the cells of the lining of the joints, the tendon and boss, and that reaction is what will lead to the pain, inflammation. The cardiovascular system might suffer hypotension or hypertension. Heart failure, either new one or the old one is worsened. There might be edema, peripheral vascular disease, bradycardia, meaning the heart rate will slow or drop. There can be pericarditis and ventricular fibrillation. The liver is not spared. There can be hepatitis or hepatotoxicity, hepatomegaly, hyperbilirubinemia, or cholestatic jaundice, and even more. The endocrine system can lead us to decreased libido, gynecomastia, metabolic acidosis or lactic acidosis, electrolyte derangement or hyperlipidemia. Renal or reproductive system can present with nephritis, urinary tract infection, hematuria, glycosuria, male impotency, infertility, uremia, oliguria. Gastrointestinal tract can present with constipation, anorexia, dysgeusia, abdominal pain, salivary gland enlargement, stomatitis, gastritis, even proctitis. There might be hemorrhagic pancreatitis. In hematology, we can run to aplastic anemia, bone marrow depression, agranulocytosis, disseminated intravascular coagulopathy, or pancytopenia. In central nervous system, The affected individual could present with agitation, amnesia, stroke, depression, dizziness, drowsiness. Other side effects or adverse reaction could include sepsis, pulmonary embolism, alopecia, onycholysis, and the list goes on. Warnings: fluid, fluid, fluid. Generously, please give fluid. If you check and there is dehydration, it must be corrected before we can commence allopurinol in that man or woman. Renal system, please, what is creatinine clearance telling us? How about estimated glomerular filtration rate? If they are low, then we'll go for low allopurinol also, and titrate up as the kidney function improves. Let us go for kidney that could deliver 2 liters of urine per day. And if the urine will be slightly alkaline, that would be better. Genetics, please, have we tested for HLA? If this is present, we should be careful in Southeast Asians, African American, or blacks generally. And is there any history of hypersensitivity to allopurinol in this individual, either Asian or not, while Latino, Hispanic, anybody? Once there is positive history of hypersensitivity to allopurinol or any component of its formulation, we don't use it today. Remember, the liver can be in trouble. The individual taking this can become drowsy, and with altered level of consciousness, they cannot operate machines. So you cannot prescribe this, and few hours later, the individual is driving on the road, or flying a jet, or commanding the ship. No. Hypersensitivity could be fatal with Stevens-Johnson syndrome, toxic epidermal necrolysis, or DRESS. When it comes to drug-drug interaction, chemotherapy like fluorouracil will react with allopurinol. Alcohol will worsen the situation. Warfarin is not good. The danosine is contraindicated. Loop diuretics, we should uric acid out the more. But I will leave the rest to the pharmacist or clinical pharmacologist. In conclusion, allopurinol could be a good medication, well tolerated, inexpensive, frequently prescribed, yes, but it could be bad when we don't take certain things into account and we just prescribe indiscriminately, or you are taking a medication that is not prescribed to you, the one from your spouse, friend, neighbor, grandpa, or grandma. It could be dangerous. With that, I've come to the end of this presentation as per allopurinol, a good medication when used appropriately. Thanks for listening. Please remember to share this. Remember to subscribe to my channel. I appreciate it.